My name is Sarah, and I've been a pediatric burn unit nurse for 12 years. I've seen things that would break most people's hearts and challenge their faith in humanity. But nothing, absolutely nothing, prepared me for what I was about to experience with a little girl who would change my life forever and expose the cold, heartless machinery that operates behind the sterile walls of our healthcare system. This is the story of how I became a mother to a child who wasn't mine, how the system tried to tear us apart, and how love proved to be the most powerful medicine of all. Let me take you back to that rainy Tuesday morning in October when everything began. The pediatric burn unit at Metropolitan General Hospital is a place where miracles and tragedies dance together in a delicate balance. The antiseptic smell burns your nostrils. The constant beeping of monitors creates a symphony of survival, and the walls, painted in cheerful colors meant to comfort children, seem to mock the pain that echoes through these corridors. I had just finished my morning rounds when Dr. Martinez, the head of pediatrics, approached me with a file in his hands and a look of deep concern etched across his weathered face. "Sarah," he said, his voice barely above a whisper, "we have a new patient coming in. 8-year-old girl, third-degree burns covering 60% of her body. House fire took her parents. She's been through hell. And honestly, I don't know if we can pull her through this, not just physically, but emotionally." He handed me the file, and as I opened it, my heart sank. The photographs showed a small figure wrapped in bandages, her eyes vacant, staring at nothing. Her name was Lily Thompson, and she was about to become the center of my universe. When Lily arrived, she was unconscious, her small body fighting for every breath. The medical team worked around the clock for the first 72 hours, performing skin grafts, managing infections, and monitoring her vital signs. But when she finally woke up, it was like watching a wounded animal that had retreated so far into itself that it might never come back. She didn't speak, didn't cry, didn't even acknowledge our presence. Her eyes held a depth of trauma that no 8-year-old should ever have to carry. The other nurses tried their best, but Lily would flinch violently whenever anyone approached her bed. She would scream when we needed to change her dressings, thrash around when we tried to feed her, and worst of all, she would just stare at the ceiling for hours, as if she had already given up on the world. The medical team was growing frustrated. Dr. Peterson, one of our most experienced surgeons, pulled me aside after a particularly difficult session where Lily had refused to cooperate with her physical therapy. "Sarah, I've been doing this for 25 years, and I've never seen a child so completely shut down. Her body is healing, but her spirit is broken. If we can't reach her emotionally, all our medical interventions won't matter. She's going to give up, and we're going to lose her." I knew he was right. I had seen it before, children who survived their physical injuries, but couldn't survive the emotional ones. But something about Lily called to me. Something in those empty eyes that reminded me of my own childhood, of the nights I spent alone after my parents' divorce, feeling abandoned and afraid. That evening, after my shift had officially ended, I found myself drawn back to Lily's room. The other nurses had gone home, the doctors had finished their rounds, and the unit was quiet except for the gentle hum of machines keeping our patients alive. I pulled a chair next to Lily's bed and just sat there, not trying to touch her, not trying to force any interaction, just being present. She didn't look at me, but I could sense a slight change in her breathing, a subtle acknowledgement that someone was there. I started talking to her, not about her injuries or her treatment, but about everyday things. I told her about the weather, about the flowers in the hospital garden, about the little sparrow that had built a nest outside my apartment window. I don't know why I did it, but I reached into my bag and pulled out a book of fairy tales that I had been reading to my niece. I opened it to Cinderella and began to read aloud. For the next 2 weeks, I established a routine. Every evening, after my official duties were done, I would sit with Lily and read to her. Sometimes it was fairy tales, sometimes it was adventure stories, and sometimes I would just tell her about my day. She never responded, never showed any sign that she was listening, but I persisted. I could see the other nurses watching me with a mixture of admiration and concern. Some of them whispered that I was getting too attached, that I was setting myself up for heartbreak, but I couldn't stop. Something deep inside me knew that this little girl needed more than medical care. She needed someone to believe in her, someone to refuse to give up on her. The breakthrough came on a Thursday evening in November. I was reading The Little Princess to Lily, a story about a girl who maintains her dignity and kindness despite losing everything. As I reached the part where Sarah Crew talks about how all girls are princesses, even when they're covered in rags and soot, I noticed Lily's eyes focusing on me for the first time. It was subtle, barely perceptible, but after weeks of vacant stares, this small sign of engagement felt like a miracle. I continued reading, my voice steady despite the emotion building in my chest. When I finished the chapter, I closed the book and looked at Lily. She was still staring at me, and for a moment I thought I saw a flicker of recognition in her eyes. The next evening, as I was preparing to leave after reading to Lily, something extraordinary happened. I was gathering my things, telling her that I would see her tomorrow, when I heard the softest whisper. At first I thought I had imagined it, but then I heard it again, clearer this time. Mom. The word hung in the air between us, fragile and precious. I turned to look at Lily, and she was staring directly at me, her eyes no longer empty but filled with a desperate hope. Mom, she whispered again, and I felt my heart break and mend at the same time. I sat back down, taking her small hand in mine, and for the first time since she had arrived, Lily didn't pull away. From that moment on, everything changed. Lily began to respond to treatment, but only when I was present. She would allow me to change her dressings, to help her eat, to assist with her physical therapy. To everyone else, she remained withdrawn and uncooperative. But with me, she was a different child. She would call me Mom in the softest voice, and I would respond with the tenderness I had never had the chance to show a child of my own. The medical team was amazed by her progress. Dr. Martinez told me that it was the most remarkable turnaround he had ever witnessed. Whatever you're doing, Sarah, keep doing it. You're saving her life. But our joy was short-lived. The hospital administration had been watching, and they were not pleased with what they saw. 3 months after Lily first called me Mom, I was summoned to a meeting with Human Resources. The woman who greeted me was Linda Harrison, a stern administrator who had never worked a day in patient care, but wielded considerable power within the hospital hierarchy. She sat behind a massive desk, surrounded by policy manuals and legal documents, her expression cold and calculating. Ms. Johnson, she began, her voice clipped and professional, we need to discuss your relationship with patient Lily Thompson. It has come to our attention that you have been engaging in behavior that violates our professional boundaries policy. I felt my blood run cold. I don't understand what you mean, I said, though I was beginning to suspect where this conversation was heading. Linda opened a file and began reading from it. According to multiple staff reports, you have been spending excessive time with the patient outside of your assigned duties. You have been observed holding hands with the patient, reading to her for extended periods, and most concerning, you have been allowing and even encouraging the patient to refer to you as Mom. And this behavior constitutes a serious breach of professional boundaries and puts both you and the hospital at risk for potential legal liability. I couldn't believe what I was hearing. Mrs. Harrison, Lily is an orphan who has been through unimaginable trauma. The connection we've formed is the only thing that has motivated her to participate in her treatment. Her medical team has documented significant improvement since I started working with her more closely. How can you call this a problem? Linda's expression didn't change. She pulled out another document and slid it across the desk. This is our professional boundaries policy. It clearly states that healthcare workers must maintain appropriate emotional distance from patients. Personal relationships that extend beyond the clinical setting are prohibited. The fact that this child has formed an attachment to you is precisely the problem. It creates an unhealthy dependency that could interfere with her long-term recovery and integration into appropriate care. I stared at the policy document, the words blurring as tears formed in my eyes. But she's getting better. For the first time since she arrived, she's eating, she's participating in therapy, she's showing signs of healing. How can you call that unhealthy? Linda leaned back in her chair, her voice taking on a condescending tone. Ms. Johnson, I understand that you believe you're helping this child, but you're not a trained therapist or social worker. You're a nurse, and your job is to provide medical care, not to play mother to damaged children. The child needs professional psychiatric intervention, not a surrogate parent who will inevitably abandon her when she's discharged or when you move on to your next assignment. The accusation hit me like a physical blow. I would never abandon her, I said, my voice shaking with emotion. I care about Lily more than any policy manual or legal document. She's been abandoned by life itself, and I refuse to be another person who walks away from her. Linda's eyes narrowed. Your emotional attachment to this patient is exactly what makes this situation problematic. You're not thinking clearly about what's best for the child or for your own professional future. I'm going to be very clear with you, Ms. Johnson. Effective immediately, you are to cease all non-clinical contact with Lily Thompson. No more reading sessions, no more extended conversations, no more hand-holding, and absolutely no more allowing her to call you mom. You will treat her exactly as you would any other patient, with professional courtesy and clinical competence, but nothing more. Is this understood? I sat in stunned silence, processing the full implications of what she was saying. What if I refuse? I asked quietly. Linda's smile was cold and predatory. Then you'll be terminated for insubordination and violation of hospital policy. You'll have a disciplinary action on your record that will follow you to any other healthcare facility. And I want to be very clear about something else, Ms. Johnson. If you attempt to maintain any kind of relationship with this child outside of the hospital setting, if you try to visit her or contact her in any way, we will pursue legal action against you for harassment and potential endangerment of a minor. Do I make myself clear? The room felt like it was spinning. Everything I had worked for, everything I had built with Lily, was being torn away by bureaucratic policies and legal fears. She needs me, I whispered, more to myself than to Linda. Without me, she'll retreat back into herself. She'll give up again. Linda gathered her papers and stood up. That's not your concern anymore, Ms. Johnson. Child Services has been notified, and they'll be arranging for appropriate psychiatric care. Your job is to follow hospital policy and maintain professional boundaries. I'll be monitoring your interactions with all patients going forward, and any violation of these directives will result in immediate termination. The meeting is over. I walked out of that office feeling like my world had collapsed. How could I explain to Lily that I couldn't be her mom anymore? How could I tell her that the connection we had built, the trust we had developed, was now forbidden by corporate policy? I made my way to the pediatric unit, my steps heavy with dread. When I entered Lily's room, she looked up at me with those bright eyes that had learned to trust again, and my heart shattered. "Mom," she said, reaching out her small hand toward me. I wanted to take it, to hold her close, to promise her that everything would be okay. But I couldn't. The weight of Linda Harrison's threats pressed down on me like a physical force. The next few days were the most difficult of my career. I continued to care for Lily, but now I maintained the cold, professional distance that the hospital required. When she called me Mom, I would gently correct her, telling her to call me Nurse Sarah. When she reached for my hand, I would busy myself with checking her chart or adjusting her medications. I could see the confusion in her eyes, the hurt and bewilderment as the person she had learned to trust suddenly became distant and clinical. She started asking me what was wrong, why I was acting differently, but I couldn't explain without violating the gag order that HR had essentially placed on me. The effect on Lily was immediate and devastating. Within a week, she had stopped participating in her physical therapy sessions. She refused to eat more than a few bites of food at each meal. She stopped talking altogether, reverting to the silent, withdrawn state she had been in when she first arrived. The medical team was baffled by her sudden regression. Dr. Martinez called me into his office, his face etched with worry. "Sarah, what happened?" 2 weeks ago, Lily was making incredible progress. Now she's back to square one, and honestly, I'm worried we're going to lose her. Did something happen between you two? I wanted to tell him everything, to explain how the hospital administration had destroyed the one relationship that was keeping Lily alive. But Linda Harrison's threats echoed in my mind, and I knew that speaking out would only make things worse for both Lily and me. "I don't know, Dr. Martinez," I lied, the words tasting like ash in my mouth. "Sometimes patients have setbacks. Maybe she's just going through a difficult phase in her recovery." He looked at me with concern, clearly sensing that there was more to the story. "Sarah, if there's something you're not telling me, something that might help us understand what's happening with Lily, please share it. Her life might depend on it." But I couldn't speak. The corporate machinery of the hospital had effectively silenced me, and I was trapped between my love for Lily and my fear of losing my career. I watched helplessly as she continued to deteriorate, her spirit dying a little more each day. The other nurses noticed the change too. Jessica, one of my closest colleagues, pulled me aside during a break. "Sarah, what's going on with you and Lily? Everyone's talking about how she's regressing, and you seem different too. You used to light up when you talked about her progress, but now you barely mention her. Did something happen?" I couldn't meet her eyes. "I'm just trying to maintain professional boundaries," I said, repeating the corporate language that had been drilled into me. Jessica looked at me with disbelief. "Professional boundaries? Sarah, you saved that little girl's life. The connection you built with her was the only thing that motivated her to fight. Now she's giving up again and you're talking about professional boundaries? What aren't you telling me?" I wanted to confide in her, to share the burden of what I was going through, but but I knew that doing so would only put her in an impossible position too. As the days passed, Lily's condition continued to worsen. She developed a fever that wouldn't break, and her surgical wounds showed signs of infection because she wouldn't cooperate with the cleaning and dressing changes. She had stopped eating almost entirely, and we had to insert a feeding tube to ensure she was getting adequate nutrition. The spark that had returned to her eyes was gone, replaced once again by the vacant stare that had haunted me when she first arrived. I felt like I was watching her die slowly, and the worst part was knowing that I was the cause of her suffering. The breaking point came on a Friday evening, 3 weeks after my meeting with HR. I was finishing my shift when I heard the code blue alarm echoing through the pediatric unit. My blood ran cold as I realized it was coming from Lily's room. I rushed down the hallway, my heart pounding, and found a team of doctors and nurses working frantically around her bed. Dr. Martinez was performing chest compressions while Dr. Peterson managed her airway. The monitors showed irregular heart rhythms, and her blood pressure was dangerously low. She was dying, and I knew that it wasn't just from her physical injuries. She was dying from a broken heart, from the abandonment she felt when I was forced to pull away from her. The medical team worked for 20 minutes before they managed to stabilize her condition. Dr. Martinez emerged from the room, his scrubs soaked with sweat, his face grave. He pulled me aside, his voice barely controlled. "Sarah, I don't know what's happening here, but this child is giving up. Her vital signs are stable for now, but she's not fighting anymore. It's like she's decided that life isn't worth living. I've seen this before in severely traumatized children. They reach a point where they just let go. Unless something changes dramatically, we're going to lose her." I stood there watching through the glass as Lily lay motionless in her bed, surrounded by machines that were keeping her alive. The child who had once called me Mom with such hope in her voice was now barely hanging on to life, and I knew that my forced abandonment of her had pushed her to this point. I made a decision that would either save her life or destroy my career. I couldn't watch her die because of corporate policies and legal fears. I walked into her room, ignoring the protests of the medical staff, and sat down beside her bed. "Lily," I whispered, taking her small hand in mine. "I'm here, sweetheart. I'm here, and I'm not going anywhere." Her eyes fluttered open, and for a moment, I saw a flicker of recognition. "Mom?" she whispered, her voice barely audible. I squeezed her hand gently. "Yes, baby, I'm here. I'm sorry I went away, but I'm here now." The monitors around us began to show improvement in her vital signs, her heart rate becoming more regular, her breathing deeper and more stable. Dr. Martinez watched from the doorway, his expression a mixture of amazement and concern. CTA Introduction. If you're watching this story and you believe that love and compassion should never be forbidden in healthcare, make sure to subscribe to Hospital Revenge. We're exposing the cold, heartless systems that prioritize policies over people, and we need your support to continue bringing you these important stories. Hit that subscribe button and join our community of healthcare warriors who refuse to let bureaucracy win over humanity. Word spread quickly through the hospital about what had happened. Within hours, Linda Harrison was at my side, her face flushed with anger. "Ms. Johnson, you are in direct violation of our previous agreement. You were explicitly told to maintain professional boundaries with this patient. Your actions tonight constitute grounds for immediate termination and possible legal action." I looked up at her, still holding Lily's hand, and I felt a calm resolve settle over me. "Then fire me," I said quietly. "But I'm not letting this child die because of your policies." Linda's eyes narrowed dangerously. "You're making a serious mistake, Ms. Johnson. Your emotional attachment to this patient is clouding your judgment. You're not helping her by encouraging this unhealthy dependency. In fact, you're harming her long-term prospects for recovery and integration into appropriate care." I felt my anger rising, but I kept my voice steady. "Mrs. Harrison, this child was dying until I sat down and held her hand. Her vital signs improved the moment she heard my voice. How can you call that harmful? How can you stand there and tell me that love is dangerous?" Linda pulled out her phone and made a call. "Security, I need you to come to the pediatric unit immediately. We have a staff member who is refusing to follow direct orders and is potentially endangering a patient." I knew that my time was limited, but I also knew that I couldn't abandon Lily again. I looked down at her small face, peaceful now that she knew I was there, and I made a promise. "Whatever happens next, sweetheart, I want you to remember that you are loved. You are worthy of love, and you deserve to fight for your life." Security arrived within minutes, Two large men in uniform who looked uncomfortable with the situation they were being asked to handle. Linda pointed at me imperiously. "Please escort Ms. Johnson from the premises. She has been terminated for insubordination and violation of hospital policy. She is no longer authorized to be in patient care areas." I looked at Dr. Martinez, hoping he would intervene, but I could see the conflict in his eyes. He was torn between his medical knowledge that I was helping Lily and his obligation to follow hospital protocol. As security approached, I leaned down and whispered to Lily, "I have to go now, but I want you to be strong. I want you to fight, not just for yourself, but for all the children who need someone to believe in them. You are braver than you know and stronger than you think." I kissed her forehead gently and stood up, releasing her hand. As I walked away, I heard her calling after me, "Mom, don't go! Please don't leave me!" The sound of her voice broke my heart, but I knew that this wasn't the end of our story. The next few days were a blur of meetings with lawyers, union representatives, and hospital administrators. I was officially terminated for violation of professional boundaries and insubordination. The hospital's legal team made it clear that any attempt to contact Lily or interfere with her care would result in criminal charges. I was escorted from the building like a common criminal, my badge and keys confiscated, my access to the place where I had worked for over a decade permanently revoked. The local news picked up the story, and I found myself at the center of a media storm that I had never wanted. But while the adult world was busy with its bureaucratic battles and legal maneuvering, Lily was dying. Dr. Martinez called me at home on the third day after my termination, his voice heavy with despair. "Sarah, I'm calling as a friend, not as a hospital representative. Lily's condition has deteriorated rapidly since you left. She's not eating, she's not cooperating with treatment, and her vital signs are becoming increasingly unstable. I don't think she's going to make it through the week. I know the hospital has forbidden you from having any contact with her, but I had to let you know. I'm sorry." I sat in my apartment staring at the phone after he hung up, feeling more helpless than I had ever felt in my life. The child I had grown to love was dying, and I was powerless to help her. The hospital had won its bureaucratic victory, but at what cost? I thought about calling the media, about exposing what was happening, but I knew that any publicity would only make things worse for Lily. She needed medical care, not a public relations battle. That evening, I received an unexpected visitor. Dr. Martinez stood at my door, his face grave but determined. "Sarah, I need to talk to you. What's happening to Lily isn't medical negligence, it's institutional cruelty. She's dying because she's been abandoned by the one person who gave her hope. I've been thinking about this for days and I've made a decision. I'm going to fight this." I invited him in, and he sat down heavily on my couch. "I've been practicing medicine for 30 years, and I've never seen anything like what you accomplished with Lily. You didn't just treat her injuries, you healed her soul. The hospital administration doesn't understand that medicine isn't just about pills and procedures. Sometimes the most powerful medicine is human connection." He pulled out a folder and showed me medical reports documenting Lily's progress during the time I had been working with her, followed by reports showing her dramatic decline after I was forced to pull away. "This is clear evidence that your relationship with Lily was not only beneficial, but essential to her recovery. I'm going to present this to the hospital board, and I'm going to demand that they reconsider their decision. I'm also going to request that they bring in child psychologists who understand trauma recovery to evaluate the situation." I felt a glimmer of hope for the first time in days. "Dr. Martinez, are you sure you want to do this? You could be putting your own career at risk by opposing the administration." He looked at me with determination. "Sarah, I became a doctor to save lives, not to follow corporate policies that kill patients. If I don't fight for Lily now, I'll never be able to look at myself in the mirror again. Will you help me? Will you document everything you remember about your relationship with Lily, the progress she made, and the techniques you used to reach her?" Over the next 2 days, Dr. Martinez and I worked together to build a case for Lily's life. We documented every interaction, every breakthrough, every moment of progress she had made during our time together. We researched child psychology literature on trauma recovery and attachment theory. We gathered testimonials from other nurses who had witnessed Lily's transformation. We built a comprehensive argument that love and human connection were not violations of professional boundaries, but essential components of healing. The hospital board meeting was scheduled for the following Monday. Dr. Martinez had requested an emergency session to discuss what he called a matter of life and death. I wasn't allowed to attend, but he promised to present our case with all the passion and conviction he could muster. As I waited at home for news, I thought about Lily lying in her hospital bed, alone and afraid, fighting for her life while the adults around her debated policies and procedures. The call came at 3 p.m. Dr. Martinez's voice was tired but triumphant. "Sarah, the board has agreed to a trial period. They're going to allow you to resume your relationship with Lily under strict supervision and with the support of a child psychologist." Linda Harrison fought it every step of the way, but the medical evidence was overwhelming. The board couldn't ignore the fact that Lily was thriving under your care and dying without it. "You can come back tomorrow." I felt a surge of joy and relief that almost brought me to my knees. How is she doing?" Dr. Martinez's voice became somber. "She's very weak, Sarah. The past week has taken a tremendous toll on her. I'm not sure how much fight she has left in her, but if anyone can bring her back, it's you. The psychologist, Dr. Rebecca Chen, will be there tomorrow to observe and assess the situation. She's specialized in childhood trauma and attachment disorders, and she's actually very supportive of what you've been doing." CTA, Intermediate. This story is about more than just one nurse and one patient. It's about the battle between human compassion and institutional coldness that happens every day in hospitals around the world. If this story is resonating with you, please hit that like button and leave a comment sharing your own experiences with healthcare bureaucracy. Your engagement helps us reach more people who need to hear these stories. The next morning, I walked through the hospital doors for the first time in over a week, my heart pounding with anticipation and fear. I had been given a temporary badge and limited access to the pediatric unit, but I was officially under probation and observation. Dr. Chen was waiting for me at the nurse's station, a kind-looking woman in her 40s with gentle eyes and a warm smile. "You must be Sarah," she said, extending her hand. "I've heard a lot about you and Lily. I'm here to help, not to judge. I've spent my career working with traumatized children, and I understand the importance of attachment relationships in healing." We walked to Lily's room together, and I was shocked by what I saw. The vibrant, hopeful child who had called me mom just over a week ago was now a shadow of herself. She lay motionless in the bed, her skin pale and her breathing shallow. The monitor showed weak vital signs, and I could see that she had lost significant weight. Her eyes were open, but they stared at nothing, just as they had when she first arrived months ago. "Lily," I whispered, approaching her bed slowly. "It's me, sweetheart. I'm here." For a moment, there was no response. Then, slowly, her eyes focused on my face, and I saw a flicker of recognition mixed with wariness. "Mom?" she whispered, her voice barely audible. I looked at Dr. Chen, who nodded encouragingly. I sat down beside Lily's bed and took her small hand in mine. "Yes, baby, I'm here. I'm so sorry I went away, but I'm here now, and I'm not going anywhere." The monitors immediately began to show improvement in her vital signs, her heart rate becoming more regular and her breathing deeper. Dr. Chen watched in amazement as Lily's entire demeanor changed. The vacant stare was replaced by focused attention, and she began to respond to my voice and touch. "This is remarkable," Dr. Chen whispered to me. "I've never seen such an immediate and dramatic response to a caregiver's presence. The attachment bond you formed with this child is extraordinarily strong." I continued to talk to Lily, telling her about how much I had missed her, how sorry I was for leaving, and how proud I was of her for fighting to stay alive. Over the next several hours, Dr. Chen observed our interactions, taking notes and asking gentle questions. She watched as Lily began to eat when I fed her, cooperated with medical procedures when I held her hand, and even smiled when I told her funny stories. "Sarah," Dr. Chen said during a break, "what you've accomplished with Lily goes far beyond normal nursing care. You've created a therapeutic relationship that is literally keeping her alive. The hospital administration needs to understand that this isn't about breaking rules. It's about providing the kind of care that this child needs to survive and thrive." Dr. Chen's report to the hospital board was unequivocal. She documented that Lily suffered from severe attachment disorder as a result of her trauma, and that her relationship with me represented a healthy, therapeutic attachment that was essential for her recovery. She recommended that I be allowed to continue as Lily's primary nurse with expanded responsibilities for her emotional care. She also recommended that the hospital develop new policies for dealing with traumatized children that recognize the importance of consistent caring relationships. The board's response was mixed. While they agreed to allow me to continue caring for Lily, they also insisted on strict protocols and regular evaluations. Linda Harrison was reassigned to a different department, presumably to prevent further conflicts. Dr. Martinez was appointed as the liaison between the medical team and the administration, ensuring that Lily's care remained focused on her needs rather than institutional policies. Over the following weeks, Lily's recovery was nothing short of miraculous. With consistent love and support, she began to thrive in ways that had seemed impossible just a month earlier. Her physical healing accelerated, her emotional state stabilized, and she began to show interest in activities beyond just survival. She started asking about school, about other children, about what would happen when she was ready to leave the hospital. Most importantly, she began to believe that she deserved to live and be happy. The story of our relationship spread throughout the hospital and beyond. Medical professionals from other institutions came to observe and learn from our experience. Dr. Chen published a case study about Lily's recovery that was widely cited in pediatric psychology literature. The hospital, initially resistant to change, began to implement new policies that recognized the importance of emotional care in medical treatment. But perhaps the most significant change was in the broader conversation about healthcare. Our story became a symbol of the battle between compassion and bureaucracy, between human connection and institutional efficiency. It sparked discussions about the role of love in healing, about the importance of treating patients as whole human beings rather than collections of symptoms and diagnoses. 6 months after I was first told to maintain professional boundaries with Lily, she was ready to be discharged from the hospital. A loving foster family had been found, people who understood her history and were committed to providing the stable, nurturing environment she needed to continue healing. The day of her discharge was bittersweet. I was happy to see her well enough to leave, but I was also sad to see her go. As I helped her pack her few belongings, Lily looked up at me with those bright eyes that had learned to trust again. "Mom," she said, "will I see you again?" I knelt down to her level and looked into her eyes. "Sweetheart, you'll always be in my heart, no matter where you go. And if you ever need me, if you ever want to talk or visit, you know where to find me. The most important thing is that you remember how strong and brave you are. You survived something terrible, and you came out the other side with your heart intact. That's something no one can ever take away from you." The foster family arrived to pick up Lily, and I watched through the window as she walked out of the hospital, holding her new mom's hand. She turned back once to wave at me, and I waved back, tears streaming down my face. Dr. Martinez stood beside me, his own eyes moist. "You saved her life, Sarah. Not just medically, but in every way that matters. She's going to be okay because you refused to give up on her." In the months that followed, I received regular updates about Lily's progress. She was thriving in her new home, attending school, making friends, and slowly learning to trust the world again. Her foster parents sent pictures of her playing soccer, participating in school plays, and just being a normal, happy kid. The physical scars from her burns would always be with her, but the emotional scars were healing, filled in by love and hope. The hospital implemented new policies based on our experience, policies that recognized the importance of emotional care in medical treatment. They established a program for training healthcare workers in trauma-informed care, and they created protocols for dealing with severely traumatized children that emphasized consistency and relationship building. Other hospitals began to adopt similar approaches, and slowly, the healthcare system began to change. But the most profound change was in my own understanding of what it means to be a healer. I had spent years thinking that being a good nurse meant following protocols, maintaining professional distance, and avoiding emotional involvement. Lily taught me that sometimes the most powerful medicine is the willingness to love, to connect, to risk your own heart for the sake of another human being. She taught me that healing isn't just about fixing what's broken. It's about believing in the possibility of wholeness, even when everything seems lost. The fight with the hospital administration had been bitter and exhausting, but it had also been necessary. It had forced an institution to confront its own values, to choose between efficiency and compassion, between policy and humanity. In the end, love had won, not because it was the easy choice, but because it was the right choice. Lily had taught all of us that some boundaries are meant to be crossed, that some rules are meant to be broken, and that the most important protocol in healthcare is the protocol of the heart. As I look back on this experience, I realize that it changed not just Lily's life, but mine as well. It taught me that being a healthcare provider means being willing to fight for your patients, even when the system tells you to step back, even when your career is on the line, even when the easier path is to follow orders and maintain professional distance. It taught me that healing requires courage, not just medical knowledge, and that sometimes the most radical act in healthcare is simply refusing to abandon someone who needs you. The administrator who had tried to keep us apart, Linda Harrison, was eventually transferred to a different hospital system. Her replacement, Dr. Sarah Williams, was a former pediatric nurse who understood the importance of emotional care in medical treatment. She worked with Dr. Martinez and Dr. Chen to establish new protocols that balanced professional standards with human compassion. The pediatric unit became a model for other hospitals, a place where healing was understood to encompass both physical and emotional recovery. But Lily's story didn't end with her discharge from the hospital. 3 years later, on a sunny afternoon in May, I was working in the pediatric unit when I heard a familiar voice calling my name. I turned around to see a tall, confident 11-year-old girl with bright eyes and a huge smile. It was Lily, visiting the hospital with her adoptive mother. She had grown so much, not just physically, but emotionally. The scared, broken child who had once called me Mom in desperate whispers was now a vibrant young person who radiated confidence and joy. "Sarah!" she exclaimed, running up to give me a hug. "I wanted to come see you and show you how I'm doing." Her adoptive mother, Maria, smiled warmly as she watched our reunion. "Lily talks about you all the time," she said. "She calls you her angel nurse, the one who saved her life. We wanted to come and thank you for everything you did for her." I looked at Lily, marveling at the transformation. Her physical scars were still visible, but they seemed to fade in comparison to the light that shone from within her. "Look," Lily said, pulling out a school notebook. "I wrote a story about a brave nurse who fought dragons to save a princess. Want to hear it?" As she read her story aloud, I realized that she had processed our experience through the lens of the fairy tales I had once read to her. In her story, the nurse didn't just provide medical care. She battled the forces of indifference and cruelty that threatened to destroy hope. The princess in the story wasn't just healed from her physical wounds. She was transformed into a warrior who would one day help other children who were lost and afraid. "Lily," I said when she finished reading, "that's a beautiful story. You're an amazing writer." She beamed with pride. "My teacher says I should enter it in a writing contest. She says it's about overcoming adversity and finding strength in unexpected places." I looked at Maria, who nodded encouragingly. "Lily's been in counseling since she came to live with us," she explained. "Her therapist says that writing these stories is her way of processing her trauma and finding meaning in her experiences. She's incredibly resilient." As we talked, other staff members from the pediatric unit gathered around to see Lily. Dr. Martinez emerged from his office, his face lighting up when he saw her. "Lily, look at you. You're so tall and grown up." She hugged him warmly, and I could see tears in his eyes. "Dr. Martinez, I'm going to be a writer when I grow up," she announced. "I want to write stories about kids who go through hard things but come out stronger. I want to help other kids know that they can survive anything." Dr. Chen, who had continued to follow Lily's progress, joined our impromptu reunion. "Lily, I'm so proud of you," she said. "You've become exactly what I hoped you would become, a strong, confident young woman who knows her worth." Lily looked around at all of us, her extended hospital family, and I could see the gratitude in her eyes. "I know I was really sick when I was little," she said, "and I know there were people who didn't think I should get better, but all of you fought for me. You made me believe that I deserved to live and be happy. Now I want to do the same thing for other kids." Before they left, Maria pulled me aside. "Sarah, I want you to know that Lily's recovery has been remarkable, but it hasn't been without challenges. She still has nightmares sometimes, and she still struggles with trust issues. But the foundation you gave her, the belief that she was worthy of love and care, has carried her through everything. Her therapist says that the attachment she formed with you was the key to her ability to form healthy relationships later. You literally saved her life, not just in the hospital, but for the rest of her life." Watching Lily walk out of the hospital that day, confident and happy, I felt a profound sense of completion. The scared, broken child who had once whispered "Mom" in the darkness had become a strong, articulate young woman who was ready to take on the world. The system that had tried to keep us apart had ultimately been forced to acknowledge the power of human connection in healing. The protocols that had once seemed so important had been rewritten to prioritize compassion alongside clinical care. But perhaps the most important victory was the message that Lily's story sent to other healthcare providers. Word of our experience spread through professional networks, inspiring other nurses, doctors, and therapists to fight for their patients, to resist the pressure to maintain emotional distance, and to recognize that healing requires both medical expertise and human love. Medical schools began incorporating our case study into their curricula, teaching future doctors that compassion is not a luxury in healthcare, but a necessity. The ripple effects of Lily's story continued to spread. The hospital established a patient advocacy program that ensured no child would be isolated from the emotional support they needed. Other hospitals adopted similar programs, and slowly the healthcare system began to change its approach to treating traumatized children. Professional organizations revised their guidelines on therapeutic relationships, recognizing that appropriate emotional connection was not a boundary violation, but a healing tool. 5 years after Lily's discharge, I received an invitation to speak at a national conference on pediatric trauma care. The organizers wanted me to share our story as an example of how healthcare providers could balance professional standards with human compassion. As I prepared my presentation, I reflected on the journey we had all taken: Lily, the medical team, the hospital administration, and myself. It had been a battle that no one should have had to fight, but it had been necessary to establish the principle that love and healing are not mutually exclusive. Standing on that conference stage, looking out at hundreds of healthcare providers from across the country, I told Lily's story with the same passion and conviction I had felt from the beginning. I talked about the importance of seeing patients as whole human beings, not just collections of symptoms and diagnoses. I talked about the courage required to stand up to institutional policies that prioritize efficiency over compassion. I talked about the transformative power of refusing to abandon someone who needs you, even when the system tells you to walk away. The response was overwhelming. Healthcare providers from across the country approached me after the presentation, sharing their own stories of battles with administrators, their own experiences of being told to maintain professional distance from patients who desperately needed human connection. Many of them had been inspired to fight for their patients in ways they had never considered before. Others had been encouraged to trust their instincts about what their patients needed, even when those instincts conflicted with institutional policies. But the most meaningful response came in the form of a letter from a pediatric nurse in California. She wrote, "Your story gave me the courage to fight for a patient of my own, a teenage boy who had been abandoned by his family after a suicide attempt. The hospital wanted to discharge him to a group home, but I knew he needed more intensive support. I fought for him, just like you fought for Lily. It took months, but we found him a therapeutic foster home with people who understood his needs. He's thriving now, and he credits our relationship with saving his life. I never would have had the courage to challenge the system if I hadn't heard your story." 7 years after that first day when Lily called me Mom, I received a phone call that brought tears to my eyes. It was Lily, now a teenager, calling to tell me that she had been accepted to a prestigious university with a full scholarship. She planned to study social work and child psychology, with the goal of working with traumatized children. "I want to be like you," she said. "I want to fight for kids who don't have anyone else fighting for them. I want to make sure that no child ever has to go through what I went through alone." As we talked, I marveled at the woman she was becoming. The scared, silent child who had once been afraid to trust anyone had transformed into a confident, articulate advocate for vulnerable children. Her physical scars had faded somewhat over the years, but more importantly, her emotional scars had healed into sources of strength and wisdom. She had taken the trauma of her childhood and transformed it into a mission to help others. "Lily," I said, "I'm so proud of you. You've become everything I hoped you would become and more. You're going to make an incredible difference in the world." She laughed, and I could hear the joy in her voice. "I learned from the best," she said. "You taught me that loving someone means refusing to give up on them, even when it's hard, even when other people tell you to walk away. That's what I want to do for other kids. Be the person who refuses to give up on them." The conversation reminded me of why I had fought so hard all those years ago. It wasn't just about one child or one situation. It was about establishing the principle that healing requires both medical expertise and human love, that the most powerful medicine is sometimes the willingness to form a connection with another human being, and that the healthcare system has a responsibility to support those connections rather than suppress them. CTA. Final. This story of Lily and Sarah represents something bigger than just one nurse and one patient. It represents the battle between compassion and bureaucracy that happens in healthcare systems around the world every single day. If this story has moved you, if it has inspired you to believe that love should never be forbidden in healing, then please hit that like button, share this video with someone who needs to hear it, and subscribe to Hospital Revenge for more stories that expose the truth about healthcare. Leave a comment below telling us about your own experiences with healthcare systems that prioritize policies over people. Your voice matters, and together we can create a healthcare system that truly heals. Today, as I continue to work in pediatric nursing, I carry Lily's story with me every day. It serves as a reminder that our job as healthcare providers extends far beyond administering medications and following protocols. We are guardians of hope, protectors of dignity, and sometimes the only voice of advocacy that our patients have. The system may try to reduce us to mere functionaries, but we have the power to be so much more. The policies that once forced me to abandon Lily have been replaced by guidelines that recognize the importance of therapeutic relationships in healing. The hospital where we fought our battle has become a model for other institutions, demonstrating that it's possible to maintain professional standards while still providing the human connection that patients need. The administrator who tried to keep us apart has been replaced by leaders who understand that healing requires both clinical expertise and emotional support. But perhaps the most important legacy of our story is the message it sends to other healthcare providers: that it's okay to care deeply about your patients, that forming therapeutic connections is not a sign of weakness, but a sign of strength, and that sometimes the most important thing you can do for a patient is simply refuse to give up on them. The system may try to tell you to maintain professional distance, but healing often requires us to cross those boundaries and meet our patients where they are, with all the love and compassion we can muster. Lily's story is ultimately a story about the power of human connection to heal even the deepest wounds. It's about the courage required to stand up to institutional policies that prioritize efficiency over compassion. It's about the transformative power of refusing to abandon someone who needs you, even when the system tells you to walk away. And it's about the ultimate victory of love over bureaucracy, of healing over policy, of humanity over institutional indifference. As I finish telling this story, I want to leave you with the lesson that Lily taught me all those years ago: that healing is not just about fixing what's broken, but about believing in the possibility of wholeness, even when everything seems lost. That the most powerful medicine is sometimes the willingness to love, to connect, to risk your own heart for the sake of another human being. And that the most important protocol in healthcare is the protocol of the heart, the unwavering commitment to see our patients as whole human beings deserving of love, respect, and the very best care we can provide. This is the story of how a little girl taught a hospital that love is not a boundary violation, but a healing necessity, and how their battle changed the way we think about healthcare forever. This is the story of Lily and Sarah, and the day that humanity won over bureaucracy in the sterile halls of Metropolitan General Hospital. This is why we fight for our patients, why we refuse to let the system win, and why Hospital Revenge will always be here to tell the stories that expose the truth about healthcare and the people who dare to put compassion before compliance.